So I was at a conference a few weeks ago, and I met one of Phillips' researchers, Dr. Charles Lagor.
Yes.
He was talking about using patient-specific decision support, meaning like abstracting data from the patient's own medical record to come up with individualized alerts and warnings. Can you talk a little bit about this?
Yeah, I think, we Phillips.
Is this still like research, experimental stuff, or is there any products coming?
Yeah, I think in terms of the patient-specific stuff that Charles is working on, that is in the research domain. I think, ultimately, I think we can get into, genetic profiles. We can get into some of the molecular tests that are going to allow us to personalize some of the algorithms today. Today we do not have that in the product, but that is where we see ourselves going forward.
Great. Okay, any questions from our peanut gallery?
This is a bit of a high-level question. We have some nurses in the audience now, and they were just curious if you could give an overview of what Phillips is doing that would impact nurses, just high-level stuff about different products that would be relevant for them.
Okay. So in the nursing domain, I think, it starts with our patient monitors. That has always been a big focus for us, is making our monitors very useful to them. We have a number of decision support tools, whether they be graphical representations of information such as Horizon Trends, such as STMap, that really helps them track a patient's conditions and treat them much more effectively without having to analyze every bit of information. To me, it's a lot about turning all this data into meaningful information that they can actually respond much more effectively to. Our Emergent solution in terms of providing the alerting information out to the nurses in their via mobile devices, I think, is another key point. And our clinical information systems, again, are very much geared towards helping nurses with their tasks. One of the things, again, maybe on the nursing domain, is one of our eICU installations. I believe it's in Anchorage, Alaska. It's actually the only eICU that's run by nursing staff. And we're doing a number of studies on that in terms of some of the really interesting clinical success stories that they've had out of that installations completely run by nurses.
Great. Other stuff?
Yep, other stuff. We have someone asking if you can tell us more about your critical care analytics portal.
Okay. I think probably the best example of that, I talked about that a little bit in terms of our ISIP solution in the critical care space, what we do out of our reporting engine, how we allow for reports to be generated. It's all built upon Microsoft technology to make that very easy to get in there, customize, generate custom reports. Really pivot into the detailed information that's most relevant to you. And again, I would urge everyone to look at what we're doing with Microsoft on the SharePoint 2010 and provide us input in terms of whether or not that's the right direction to go into.
Yep, we have another 5 minutes. Great. Yep. So I just wanted to mention that in my mind, the Phillips brand is very connected to a human approach to medicine. And it seems to me that it's sort of part of your DNA to think about the patient experience. And in my mind, that's always distinguished you from other people who offer similar technologies. And I've been very impressed by that. And as a woman, I care about that. Yeah. And I just wondered if you could maybe just say a few sentences about why that's important to Phillips and how that's going to impact what you do going forward.
Yeah, I think that's a great point, and thank you for bringing that up. It really does. What is your your culture as a company, and what is your values? How are your values? And it really is centered around the patient. And when we talk about why not the EMR, it's because we really want to keep our focus on that patient. We don't want to have to get into, I guess we don't want to dilute our focus by looking at those more of those administrative details. And by keeping our innovation focused on that area, we're coming up with great solutions out of our research organization. We started talking about the ambient solutions around our imaging modalities, where we customize the environment so that it reduces the amount of anesthesia that has to be delivered to the patient. We reduce the time that it takes to take some of these procedures. To me, that's how we're really going to address a lot of the goals with healthcare reform. So going forward, we're looking at how we can do more, of those type of things, whether it be, the healthy environment in the home, whether it be a healthy environment in acute care. I think those are all areas that our research organization is going to be contributing a great deal going forward.
So what are some of the products or services you have on display here at HIMSS, and what booth are you at?
I'm going to do a phone a friend to get the booth number, I believe.
Okay.
1933 in Exhibit Hall C. We have our complete line of patient monitoring solutions. We have our EICU solution from VisiQ. Right adjacent to the core Phillips booth, we have our emergent solution. We have our complete line of acute care clinical information systems, and focusing on critical care, obstetrics, anesthesia. We have our complete line of PAC solutions, both in the radiology space and the cardiology space. We have a lot of solutions, clinical applications that are built on top of those. Integral breast workstation was something that was just released, which is kind of born out of our new women's healthcare business that we've created, so that we can focus on women's health issues that quite frankly I don't think have gotten some of the attention that they have needed in the past. And I guess maybe another thing to mention is we've incubated another new business that we call Care Servant, which is really I think it's probably the first time it's shown here at HIMSS, and it's really about helping educate patients into this transition out of the hospital, and it can deliver some of those education materials to those patients before they have to leave the hospital, and you just get this big rush of papers as you're getting rushed out of the door in a wheelchair.
Well, exciting stuff from Phillips here at HIMSS. I'm Nick Jeans, and this has been Dale Wiggins, their Vice President and Chief Technology Officer.